Hi everyone, I am Jebisha, lecturer of Global College of Allied Health Sciences. Today we are discussing about barium meal. It is the radiographic examination of the upper gastrointestinal tract and proximal small bowel. A barium meal is performed to diagnose structural or functional abnormalities of the esophagus, stomach and duodenum by using barium sulfate contrast media. It may be performed as single or double contrast study in the radiology department. The barium meal examination may be performed in two methods. First, a single contrast study, and second one is double contrast study. Single contrast study is performed for the evaluation of the stomach and duodenum disorder and abnormality. Second one is double contrast study. The double contrast study is performed for the evaluation of the mucosal details. Then we are moved into indication. Indication means a reason or condition that shows why a particular test or treatment or procedure is needed. First one is lack of appetite. Then second one is epigastric pain. Epigastric pain means it's pain in the right side, pain in the upper middle part of the stomach. Heartburn. Dyspepsia means indigestion and suspected gastric and duodenal obstruction, upper abdominal mass, malrotation, gastric esophageal reflux disease, weight loss, anemia, hiatus hernia. These are the indication in the barium meal. Then contraindication. Contraindication, it means a condition or reason why a particular test or treatment or procedure should not be performed because it may be harmful to patient. First one is complete large bowel obstruction and suspected perforation, suspected fistula, recent biopsy of GI tract and suspected pregnancy. Equipment, what are the equipments are used in the barium meal? That equipments are fluoroscopy unit, tilting table attached with image intensifier or spot filling device, high speed cassettes. Thin density of barium sulfate suspension for single contrast study and thick density of barium sulfate suspension for double contrast study. Then effervescent powder for double contrast study. Effervescent powder, it is a gas producing agent. It uses in double contrast study. Then patient preparation. The patient should be prepared with these followers. Yes, first one is the patient is asked to take low residue diet for 2 days prior to the examination and drink clear liquids the day before the examination. Laxative is given. Why laxative means it is an oil-like substances. It may be given to patient the night before the examination. A laxative is given for bowel preparation and cleansing prior to the examination because residue gas and fecal can obscure the image. Fasting may be employed for 4 to 6 hours. Ask the patient not to eat or drink after midnight. Women should inform about any possibility of pregnancy. The patient is instructed not to smoke or eat chewing gum because it prevents the proper coating of barium sulfate on mucosa. The patient is instructed to remove all metallic objects and jewelry from the body. Then move into procedure. It is an important process. First of all, on the day of the examination, the technology should describe the whole procedure to the patient and obtain written consent from the patient for permission for procedure. The patient is asked to remove clothing and wear a hospital gown. Then single contrast study. Single contrast study, the patient is placed in an upright position. Then patient is instructed to take 10 to 15 ml of barium sulfate. One mouthful of barium sulfate is given and asked to swallow. The passage of barium is examined by the radiologist under fluoroscopy machine. After the fluoroscopic examination of the esophagus, the patient is placed in the supine position on the fluoroscopy table. Then 150 ml of thin density barium sulfate is given. After then, rotate the patient in clockwise to make a coating of barium on the stomach mucosa. Afterward, the patient placed in prone position. In this position, the barium enters into the duodenum through the pylorus of the stomach. The radiologist observed the flow of barium sulfate in the stomach under the fluoroscopy, and whenever the barium enters into the duodenum, spot film is taken. Then the patient is turned into the right anterior oblique position, right prone, patient prone right side down. In the RAO position, RAO means it's a right anterior oblique position, the barium fills the pylorus and the duodenal bulb. Therefore, the spot film is taken. Then, additional film for the single contrast study. For the evaluation of the fundus and duodenal fourth part, radiograph are taken in supine AP position. For determination of the hiatus hernia, the patient is placed in Trendelenburg position. Then, apply compression on the abdomen and radiographs is taken. For assessment of the duodenal bulb and retrogastric space, the patient is placed in right lateral position and radiograph is taken. For the evaluation of the greater and lesser curvature of the stomach, radiographs are taken in prone position with a central ray is angled as 30 degrees cephalic. Then move into double contrast study. For double contrast study, the patient is placed in an upright position, then hypotonic agent buscopan or glucagon is given to the patient suspended to peristaltic movement. For after 100 ml of the high density of barium sulfate with effervescent powder. Effervescent powder means is a gas producing agent is given to the patient and asked to swallow. The patient is not to burp up after the swallowing. The passage of barium is examined by the radiologist under the fluoroscopy machine. After, the patient is rotated in clockwise 8 to 10 times for good coating on the stomach mucosa. The radiologist observes the flow of barium sulfate and air means an effervescent powder, in the stomach under the fluoroscopy. Then the patient turn into the left posterior oblique position. Left posterior oblique is also called LPO. LPO is a left posterior oblique position. In left posterior oblique position, the air is filled in the pylorus and duodenal bulb. Spot film is taken. Then additional filming. For air-filled duodenal bulb, the patient is placed left lateral position, gas is filled in the duodenal bulb and spot film is taken. For the air fill in the upper body of the stomach and supine table tilt head up position. In this position, gas filled in the upper body of stomach and then spot film is taken. Then move into an aftercare. Aftercare is also important. The patient is advised to increase the fluid intake. Inform the patient about the feces will be wait for 2 days. The patient should be panic about this, so inform them properly into the patient. Next, the patient will be allowed to leave the examination room after completion of the examination. Thank you.